Hi everyone, my name is Rachel Merkel, and today we are going to be talking about two different cases. The first one is a newborn baby who shortly after birth becomes lethargic and hypothermic, and they suspect a metabolic disorder, and on blood tests they find that her blood ammonia level is severely elevated. So ammonia is produced through the metabolism of amino acids and other nitrogen-containing compounds. The process of producing ammonia in the body is called transamination, which is followed by deamination. Transamination is when an amino group is removed from an amino acid and transferred to a keto acid. This is catalyzed by transaminase or aminotransferase enzymes. Deamination is the removal of an amino group from a molecule, and it's catalyzed by deaminases. Transamination forces the breakdown of amino acids and the conversion of essential amino acids into non-essential amino acids. The excess amino acids are diverted to the generation of the non-essential amino acids. Ammonia is then excreted by converting it into urea in the liver. So glutamine is transaminated to form glutamate, and this is catalyzed by glutaminase. Glutamate then undergoes deamination to form free ammonia. This is catalyzed by glutamate dehydrogenase. So deamination is a reversible reaction, and the reverse is catalyzed by glutamine synthetase. So the ammonia in peripheral tissues is then transported by the glucose-alanine cycle back to the liver, and the urea cycle then takes place in the liver, which converts this ammonia into urea to be excreted. So in the fasted state, carbohydrates are depleted. So ammonia will be, amino acids are used to produce energy. The glucose-alanine cycle transports the ammonia from the muscles to the liver, where it undergoes gluconeogenesis, which is the production of glucose in the liver to be sent out into the body. So this patient is most likely deficient in ornithine transcarbamylase. So when OTC is deficient, carbamyl phosphate accumulates and forms orotic acid. This leads to this significantly elevated orotic acid level that is shown in this patient. So she is probably not deficient in enzymes such as arginase, arginosuccinase, and arginosuccinate synthetase, because the deficiency in these enzymes would cause an increase in plasma citrulline levels, and those were shown to be normal. So in the case of this deficiency of OTC, arginine becomes essential. This is because there is decreased citrulline production and urea cycle deficiency, so this inhibits the overall production of arginine. So the next case is a man who presents with severe pain in his toes and is likely due to gout. Gout is characterized as an excess of uric acid. This patient consumes significant amounts of high fructose corn syrup in his soda. Fructose is broken down into purine, which is then converted into uric acid. So substantial amounts of fructose in the diet will lead to a significant production of purines and therefore uric acid. Excess uric acid is stored in the joints, which can ultimately lead to the development of crystals and therefore gout. Uric acid levels will rise with this continued consumption of soda and high fructose corn syrup. So the patient's elevated plasma urate level and low uric acid level indicates that the excess uric acid is being stored in the body and not enough of it is being excreted. The root cause of this patient's condition could be due to the overproduction of purines, and this is the likely cause. This is indicated by the elevated uric acid levels in his blood. Decreased urinary excretion of uric acid could also be causing this. It's probably not the root cause, though. It's likely secondary. So this is all indicated by the decreased uric acid levels. So based on his history and his typical diet, we can infer that the overproduction of purines is what is ultimately driving this condition. Decreased salvage of purines is not a likely cause at all, because with gout, purine production has to be elevated, or else you're not going to get the overproduction of uric acid. And decreased salvage of purines would cause a decrease in those blood uric acid levels. So this patient's earlier dietary modification, where he switched from diet soda to regular soda, has a significant impact on the development of gout, because the excessive consumption of high fructose corn syrup causes the overproduction of purines. This ultimately increases the amount of uric acid in his body and specifically in his joints. That uric acid in the joints eventually will begin to crystallize, which is what leads to the presentation of severe pain, limited range of motion, redness and swelling, and his inability to bear weight on his affected foot.